Thank you, Dr. Mary Nabukenya Mudiope. I work with the USAID flagship project to the Ministry of Health TB program. The Ministry of Health, together with its partners, has scaled up the coverage of the Gene-Xpert machines as one of the WHO recommended diagnostic tools for TB.
This one is a Gene-Xpert machine. We have two Gene-Xpert machines. This one is a 16 module. Just count 1, 2, 3 up to 16. And then we have the 4 module. This one we received it yesterday. This one we received it yesterday.
You heard what director was talking?
Yes.
That is it. The one that is now able to detect what?
Yeah. To detect the drugs, especially the resistance to drugs used.
Recently, the country has over 300 machines, such machines, Gene-Xpert machines. We started with the 2 modules. 2 modules, it means it tests 2 samples. Along the way, we got 4 modules, which tests 4 samples at the same time. So among the 300, we have around 16 machines in the country that are 16 modular, meaning every 2 hours they can run 16 samples at the same time. The 4 modular, they can run 4 samples every 2 hours, and the 2 modular can run 2 samples every 2 hours. So out of those 300, 16 are 16 modular. Regional referral hospitals in Moroto, we have 1 in Irira, we have 1 in Igulu. Most of these centers are Arua, Fort Portal, Mubende, Masaka, and the National Referral Hospital. So all those hospitals are there to help see that we test many people in a short time at the same time. So like Rira, they are able to test 16 patients at the same time to access this test. Rira covers the northern belt. As we have seen, the TB burden has a higher burden than other regions of Uganda. The northern belt cuts across West Nile, Arua side, Acholi, Lango, Karamoja, Soroti. So all those areas have a higher burden of TB. So we are able to test more people present with symptoms of TB. So we are able to test many of them at the same time. Even MDR has a higher number of MDR. And this expert machine helps us to test for TB number 1. Do you have TB or not? But even when we find that you have TB, is it the one that is resistant or not? So in one go, we shall know you have TB and the TB is resistant, so we start you on treatment quickly.
Why do men have more TB than women? I think I mentioned that of every 4 patients with MDR, 3 of them are men. It's an observation. You know, we can infer information from just observing. What do you see? We think it's a social behavioral issue that men, like you say, they spend more time outdoors, and we think that at the end of it, imagine men in a bar, in a closed place, and they're watching football. If one has TB and they score a goal, they shout. And that person, if they have TB, they are sitting, they release the TB germs, and everyone in that bar will inhale the TB.
Uganda enthusiastically embraced this model. At first, it began with tuberculosis, HIV, then with epidemics, but now we integrated other diseases.
We encourage men out there, please, when you have a cough, come and we test you for TB.